Likelihood of having a heart attack took its sharpest increase for all ages during the COVID-19 pandemic. How can we knock off cardiovascular disease as a leading cause of death in the United States? Well, certainly the pandemic didn't help any of us in terms of improving our cardiovascular health. Interestingly enough, the majority of individuals actually leaned into a truly sedentary lifestyle for the better part of a year or two. Unsurprisingly, cardiovascular disease and related deaths surged during the first few years of the pandemic, with many new and increasingly severe reports becoming more and more common. Traditionally, things like diet, exercise, and even medications have been shown to be effective in terms of staving off cardiovascular disease itself. However, risk factors are becoming more and more prominent, including high blood pressure, cholesterol, and obesity, to name a few. However, many individuals find themselves in urgent need for more aggressive and invasive options than simply diet, exercise, and medication when it comes to treating plaque buildup in their arteries. Typically, this means surgery. The common practice is the implantation of a wire mesh system called a stent to help open the arterial lumen to restore blood flow to the vital organs. Stents have a long-standing history of being a safe and effective treatment option for those individuals at risk of a stroke or a heart attack. But a common problem that surgeons face is what to do if the stent is prematurely deployed or if a surgeon mistakenly implants it without adequate coverage of the target lesion. Well, our team has taken our current endovascular balloon dilator, something that is currently marketed by our organization and offered by several of our competitors, and taken a unique innovation to this design. Specifically, within the inner portion of the balloon, we have decided to insert a magnetic mesh into the balloon catheter. This design will allow users to snake the catheter to the deployed stent, inflate it so that it encapsulates the stent, hopefully attracting it with magnetism, and thus allowing the stent to be retracted when the balloon deflates to reposition it within the arterial wall. Although this represents an incremental design improvement to our current system, the time and funding required is substantial to get this product in the formal development and pre-DV testing phase. This technology could be a game changer, with no other stent repositioning solution currently on the market. While this does constitute a significant amount of prototyping and feasibility assessment, our team is confident that we can bring this technology to market and continue to improve the cardiovascular treatment of patients.